Today, we're really diving deep. We're looking at how AI, artificial intelligence, and machine learning are, well, not just tweaking, but truly reimagining cancer treatment, precision oncology. We want to unpack some maybe surprising shifts happening right now in cancer care that you might not even be aware of. Yeah, our mission here is to pull out the key insights from the latest research, how AI and ML are changing things for patients. So let's get right into it. The nuts and bolts. How exactly are these technologies making a tangible difference in cancer care like today?
It's a great question. What's really fascinating is seeing how AI, machine learning, and especially deep learning models are now able to learn from just vast amounts of data
Yeah.
and make predictions. And you hear about large language models, LLMs, like the GPTs. They're a big part of this too now. They help with, natural language interaction, analyzing text, images, all sorts of data together. It's basically letting us analyze and interpret medical information at a scale we just couldn't before.
Okay, so scale and interpretation. Where's the first big impact then?
Well, a huge area is digital pathology. AI is fundamentally changing how we look at tissue samples. And here's something pretty surprising. AI can actually automate scoring for biomarkers, things like PD-L1 or HER2.
Right, those are critical for treatment decisions, especially immunotherapies.
Exactly. And the AI isn't just faster or more consistent, which it is. It's actually identifying more patients who could potentially benefit from these therapies compared to purely manual methods.
Wow, so it's finding things maybe the human eye misses?
In a way, yes.
Mm.
Or interpreting patterns differently. And what's more, AI is getting incredibly good at predicting key molecular details like genetic mutations, think HER2 again, or DRCA, or
Yeah.
MSI status in colorectal cancer,
Yeah.
directly from the standard H&E stain slides, the same ones pathologists have used for, well, decades. The accuracy we're seeing, for instance, predicting MSI status, it's reaching levels like AROC up to 0.96. That's really impressive.
Near perfect. So that could mean fewer specialized tests needed,
Right.
streamlining things for the patient.
Precisely. It could potentially streamline workflows, cut down on waiting times for you, and reduce the need for maybe more invasive or costly tests.
So it's seeing more in the images we already have. Does that apply to things like CT scans or MRIs too?
Absolutely. That leads right into radiomics. This is where AI takes medical images like CTs and MRIs and transforms them into quantifiable data points, numbers AI can analyze.
Beyond just looking at the picture.
Exactly. AI models have shown significant improvement in diagnostic accuracy. Think detecting tiny lung nodules or improving breast cancer screening. There have been studies, for example, in mammography where AI assistants significantly boosted the performance of radiologists.
So catching things earlier, more accurately.
Yes. Imagine finding a small tumor much earlier than might have been possible before, just because the AI detected subtle patterns in a scan. It means potentially earlier, more precise diagnoses for you, which can completely change the outlook.
Okay, pathology, radiology. What about all the text data? Patient records, research papers?
Great point. That's where LLMs in the clinic are starting to make noise. We're talking about large language models specifically tuned for medicine. They're becoming really powerful decision support tools. Here's a memorable detail. A system called Almanac, when they enhanced it with specific medical data, actually gave better answers to clinical questions than even advanced generic models like ChatGPT-4.
Interesting. So it's not just a smart search engine.
Not at all. Think of it more like an AI co-pilot for the clinician. It can sift through mountains of research, analyze electronic health records for patterns, maybe even flag potential adverse drug reactions based on a patient's profile.
That sounds incredibly powerful, almost like a super researcher for every doctor.
Yeah.
But, okay, here's where I start wondering about the challenges. It sounds amazing, but what are the big hurdles to actually getting this fully integrated?
That's a really important question. There are definitely significant hurdles.
Like the black box problem, right? If the AI makes a recommendation, but we don't know why, how do doctors or patients trust that? Especially with something as serious as cancer treatment.
That's arguably the biggest one. The black box nature of some complex models. We absolutely need explainable AI or XAI techniques so we can understand the reasoning. Building trust is paramount. Then there's data bias. If the AI is trained mainly on data from one population group, its predictions might not be accurate or fair for others. This could worsen health inequities.
A really critical point.
And finally, rigorous clinical validation is essential. We need large-scale studies across different hospitals and patient groups to prove these tools are safe, effective, and truly beneficial before they become standard practice.
So explainability, bias, and validation. How are we tackling those?
Well, there are promising approaches. Federated learning, for example. This lets AI models train on data from multiple institutions without the sensitive patient data ever leaving its source hospital.
So it protects privacy while still creating better models.
Exactly. It helps build larger, more diverse data sets to combat bias without compromising privacy. And looking further ahead, there's exciting work on digital twins.
Virtual patients.
Sort of, yes.
Yeah.
Creating detailed computational models of individual patients. These could potentially speed up clinical trial design, test drug efficacy virtually, and accelerate getting new treatments developed.
Okay, so despite the challenges, the path forward seems pretty revolutionary. What's the big takeaway here for someone listening? Where is this all truly heading? It feels like AI isn't just another tool like a better scanner. It's becoming more like an active partner in care, shaping diagnosis and treatment in really fundamental ways.
I think that's a good way to put it. The immense promise is an era of truly personalized cancer care. Optimizing treatments, predicting responses, improving outcomes, all tailored specifically for you.
So let's end with this thought. Imagine a future where your healthcare isn't just reacting when you get sick, but is constantly learning from your data, from millions of others adapting and making every decision as precise and effective as possible just for you. What kind of new possibilities does that future really open up at the intersection of technology and your own health?